Have you ever been told the truth about what intimate self-care really does to your body after 60? Most women haven't. And here's the shocking part. It can either awaken circulation, restore comfort, and even protect your bladder. Or it can quietly accelerate dryness, irritation, and aging in the most delicate part of your body. No one talks about this. Doctors rarely explain it. And yet, every week in my clinic, I meet women in their 60s and 70s who whisper the same questions. Why am I still feeling dry? Why do I wake up sore the next morning? Why do I feel more tired instead of more alive? The truth is self-care. After menopause is no longer just a private act. It becomes a powerful influence on your health, your hormones, your confidence, and even your sleep. I'm Dr. Perriera, a gynecologist with more than 30 years of experience guiding women through menopause and beyond. And what I'm about to share could change the way you see your body forever. Here's what most women are never told. Intimate self-care is directly tied to the strength of your pelvic floor, the elasticity of your tissues, and even your ability to resist infections. It can be deeply healing, but it can also be harmful if you make the wrong choices afterward. I think of Eleanor, 72, who came to me embarrassed by constant irritation. She thought she was just too old. In reality, one small habit she did after self-care was stripping away her body's natural protection. Once she learned the truth and changed that routine, her discomfort began to fade in just weeks. She told me I thought this part of me was gone forever. I can't believe no one explained it sooner. That's why you need to stay with me. In this video, I'll give you clear, science-backed answers every woman over 60 deserves to know. Why private wellness matters more now than it ever did in your 30s or 40s. The biological changes happening inside your tissues and how self-care can either reverse or worsen them. The single most common mistake women make afterward that silently accelerates dryness, discomfort, and premature aging. And I promise this, once you understand these truths, you'll see your body not as broken or old, but as capable of renewal if you treat it with the right care. So please, before we dive deeper, support this community. Tap, like so more women over 60 can hear this message. Subscribe, and turn on the bell for weekly health advice that doctors rarely share. And in the comments, type 1 if you believe women deserve open conversations about their bodies after 60 or 0 if this feels new to you. Your voice matters because silence has held women back for too long. Now let's begin with the first truth. Why talking openly about self-care after 60 is no longer optional. This isn't just about intimacy. It's about your health, your comfort, and your quality of life every single day. When most women think of self-care, they think only of sensation, something private, maybe even a little indulgent. But the biology happening inside your body is far more profound. And if you understand it, you'll never look at this practice the same way again. After menopause, estrogen levels naturally decline. That one change sets off a cascade. The tissues that once felt cushioned and supple begin to thin. Blood flow to the pelvic region slows nerves, lose some responsiveness, and muscles, especially the pelvic floor, start to weaken. Many women tell me I thought I was just drying up with age. In reality, their bodies were begging for circulation, oxygen, and stimulation. Think of your intimate tissues as a living muscle. If you never move it, it weakens. If you bring fresh blood and oxygen, it strengthens. And here's the beauty: self-care after 60 can do exactly that. When you touch yourself, even gently, your blood vessels dilate. Oxygen-rich blood rushes in. Cells that have been starving for nourishment are suddenly bathed in life again. The walls of your vagina become more elastic, more resilient, and even better able to defend against infections. It's like opening the window of a room that's been closed off for years. The air changes. Everything feels renewed. Let me tell you about Linda, 66. She came to me with constant dryness and irritation. She'd stopped intimacy altogether, both with herself and with her partner, because she thought it wasn't worth the discomfort. We talked about how her body was still capable of healing, but it needed circulation and stimulation. At first, she was skeptical, but after a few weeks of gentle self-care with the right aftercare habits, she told me, "It's like my body woke up again. I thought this part of my life was finished, but I feel alive." And it doesn't stop there. Orgasms themselves act like a workout for your pelvic floor. Each contraction strengthens the foundation that supports your bladder and uterus. Women who practice regularly often notice fewer leaks, less urgency, and more confidence when laughing or sneezing. It's a natural exercise routine built right into your body. There's also a powerful hormonal effect. Orgasms release oxytocin, dopamine, and endorphins, the very chemicals that calm your nervous system, lift your mood, and help you sleep. Many of my patients tell me they finally sleep through the night on evenings when they practice gentle self-care. One woman even called it better than my sleeping pills. I often remind my patients your body is not betraying you. It is adapting. What once came effortlessly now requires intention. And self-care done with awareness is one of the most natural ways to give your body what it craves: circulation, elasticity, hormonal balance, and calm. But here's the key. Biology and intimacy cannot be separated after 60. If you approach self-care carelessly, rushing, using no lubrication or skipping aftercare, you can cause tiny tears, irritation, and even infections. If you approach it with tenderness and knowledge, you unlock a cascade of healing that no prescription can fully replace. So let me ask you, when was the last time you thought about self-care as medicine, not just pleasure? Most women never have. And that's why this conversation matters. Up next, we're going to talk about something even more challenging, the emotional side, because biology is only half the story. For many women, the hardest barrier isn't dryness or muscle weakness. It's shame, silence, and guilt carried for decades. And until you face those feelings, the science alone cannot set you free. Stay with me, because in just a moment, I'll show you why letting go of shame may be the most healing act of self-care you'll ever do. For many women over 60, the greatest barrier to enjoying self-care is not biology, it's emotion. The shame, guilt, and silence that were placed on your shoulders decades ago still linger quietly inside. I cannot count how many times I've sat across from a woman in her late 60s or 70s, her voice barely above a whisper, as she confessed, "I still feel guilty," like I'm doing something wrong. These women lived entire lives being told that intimacy was for their husbands, not for themselves, that after menopause their desires should fade, that touching their own bodies was dirty, selfish, or shameful. But silence is heavy. It weighs on your spirit, and over time it robs you of freedom. Let me tell you about Teresa, 71. She admitted she had never once looked at her own vulva in a mirror. Not once. She said, "I raised 3 children, I was married for 40 years, but I still feel embarrassed to even look at myself." Her story is not unusual. Many women grow up believing their body belongs to others, to family, to partners, to society, but not to themselves. And then there's Margaret, 68. She burst into tears in my office when she confessed she still felt guilty even after her husband had passed away years earlier. "It feels like I'm betraying something," she said. But what she was really betraying was her own need for comfort, healing, and connection. Here's what I tell every woman: you are not broken. You are not sinful. You are not wrong. You were handed generations of silence, and you carried it because you thought you had to. But it was never yours to carry. When you finally give yourself permission to let go of that silence, something remarkable happens. The tension eases, the guilt begins to dissolve, and your body responds differently. Your muscles soften, your breath deepens, your tissues relax. What once felt mechanical or uncomfortable becomes tender, soothing, even joyful. I remember one patient, Elaine, 73, who told me she felt silly crying after self-care. She thought it meant she was lonely. But when she allowed herself to see those tears as healing her body's way of releasing decades of grief and responsibility, she discovered a new sense of peace. She told me later, "It felt like I put down a heavy bag I didn't even realize I was carrying." This is why I say self-care is not rebellion. It is self-connection. It is not indulgence. It is medicine. It is your body's way of reminding you, I am still alive. I am still capable of joy. And here's the truth every woman deserves to know. Intimacy is not erased by menopause. It evolves. It becomes more layered, more tender, sometimes more complicated, but no less important. When you stop hiding from yourself, you begin to heal not just physically, but emotionally. Think about it. How many years of your life were shaped by rules and silence that never served you? Isn't it time to lay those down? So here is my encouragement for you. The next time you allow yourself a moment of self-care, give yourself permission to feel whatever rises. If laughter comes, embrace it. If tears fall, let them. If calm surrounds you, breathe it in. That emotional release is not weakness. It is wisdom. It is your body completing the circle of healing. And once you reclaim that emotional freedom, you open the door to something extraordinary, the true benefits of self-care after 60. Because when you remove shame, you make space for healing. And that's when your body begins to respond with vitality, circulation, and comfort you thought you had lost. In a moment, I'll show you the real, tangible benefits of self-care after menopause. The physical changes that protect your bladder, strengthen your muscles, and even improve your sleep. What I share next may surprise you, because it goes far beyond intimacy. It reaches into every part of your daily life. Whenever women over 60 ask me, "Does self-care really matter at my age?" I always smile gently, because the answer is not just yes, it's absolutely. And the benefits go far beyond intimacy. Let's start with the physical side. When you practice gentle self-care, blood flow increases to tissues that desperately need oxygen and nourishment. This circulation improves elasticity, helping reduce the painful dryness so many women silently endure. I've seen patients who thought they had to live with constant irritation discover that within weeks of consistent mindful self-care, their tissues felt healthier, softer, and more resilient. Take Rosa, 67, from California. She told me that sitting down was uncomfortable, walking long distances left her sore, and intimacy with her partner was nearly impossible. She believed it was just old age, but once she allowed herself to practice gentle self-care paired with the right aftercare routine, she noticed her discomfort ease. Within 2 months, her tissues were more supple, her infections stopped recurring, and she smiled at me and said, "I feel like I got my body back." There's also the pelvic floor benefit. Each orgasm is more than a moment of pleasure. It's like a workout for the muscles that support your bladder and uterus. Every contraction strengthens those muscles, helping prevent leaks and even prolapse. Women often come to me embarrassed by bladder urgency or leakage when laughing or sneezing. And one of the most natural ways to strengthen those muscles isn't just Kegels, it's the contractions built right into your own body's response. I'll never forget Eleanor, 71, who confessed she was terrified to laugh in public because of her leaks. When she committed to a routine of self-care and pelvic floor relaxation afterward, her confidence began to return. "For the first time in years, I feel like I can leave the house without worrying," she said. That's not indulgence, that's freedom. Then there's the hormonal release. After self-care, your brain floods with oxytocin, dopamine, and endorphins, the same hormones that lift mood, ease stress, and help you feel calmer. Many women tell me they finally sleep through the night after evenings of gentle self-care. One patient, Teresa, 69, called it better than my sleeping pills. She had struggled with restless nights for years. But with intentional self-care, her sleep became deeper, her mornings brighter. And let's not forget the emotional and psychological benefits. I've seen women rediscover joy in their own skin after years of self-doubt. They walk differently. Their shoulders straighten, their eyes brighten. Because when you honor your body this way, you send yourself a message: I am still alive. I am still worthy of comfort, connection, and joy. Self-care after menopause is not just about desire. It's about healing. It's about giving your body what time hormones and silence have slowly taken away. It's about protecting your tissues, strengthening your foundation, calming your mind, and renewing your spirit. But I must also caution you. As powerful and healing as it can be, self-care can cause harm if it's approached without awareness. Too many women unknowingly make mistakes that leave them irritated, sore, or disappointed. And often it isn't their fault. No one ever taught them what to do differently. That's why in the next part I'm going to walk you through the hidden risks and common mistakes women over 60 make with self-care. Some of these errors may surprise you. One of them is so common that nearly every woman I've spoken to admits to it, and yet it quietly accelerates dryness and aging in the very tissues you're trying to protect. Stay with me, because avoiding these mistakes could mean the difference between feeling renewed and feeling broken. As healing and empowering as intimate self-care can be after 60, there are also risks when it's done without awareness. And sadly, too many women unknowingly hurt themselves in the very moments they're seeking comfort. These mistakes are common, but they can quietly accelerate dryness, irritation, and even infections. Let's uncover them together. The first mistake is using no lubrication at all. After menopause, natural moisture declines as estrogen drops. Friction without support can lead to micro-tears, burning, and soreness. Many women come to me embarrassed, saying I thought pain was just part of getting older. But in reality, their tissues were simply being asked to do more than they could handle without help. A small amount of the right lubrication, water-based or silicone-based, unscented, and designed for intimacy, can make the difference between healing and harm. The second mistake is using harsh products. Some women reach for soap oils or even lotions not meant for intimate areas. These strip away the protective bacteria and alter the pH balance, leaving the vagina more vulnerable to infections. I once treated Susan, 70, who thought her recurring irritation was just hormones. But when we traced her routine, she admitted she was using a fragranced body wash after every self-care session. Once she switched to plain lukewarm water, her symptoms vanished. The third mistake is relying only on strong vibrators. While there's nothing wrong with using devices depending solely on intense vibration, can overwhelm delicate nerves and reduce sensitivity over time. I've had women tell me I can't feel anything unless it's very strong. That's not because their bodies are broken, it's because their nerves have adapted to intensity. Adding variety, gentle touch, slower build-up, or even focusing on different areas like the inner thighs helps keep sensation alive. The fourth mistake is rushing. So many women are used to hurrying through pleasure, almost as if it's something to get over with. But here's the problem. When arousal doesn't have time to build blood flow, isn't sufficient, tissues remain fragile, and instead of nourishing your body, you leave it strained. Think of it like exercising. Without warming up, injuries are far more likely. The fifth mistake, the most dangerous one of all, is silence. Ignoring pain. Brushing off discomfort. Convincing yourself that suffering is just part of age. I can't tell you how many times I've heard women say, "It hurts, but I just thought that was normal now." No, it is not. Pain is not your body betraying you. It is your body asking for change. And when you listen, you open the door to healing. I'll never forget Maria, 74. She had stopped self-care entirely because of burning pain. She was convinced she was too old. But when we discovered she was using no lubrication rushing and then scrubbing harshly with soap afterward, it became clear her habits, not her age, were causing the problem. With small adjustments, she found relief. The tears in her eyes when she realized she wasn't broken, that memory will never leave me. Here's the truth. The same act that can restore your body can also injure it if you're not mindful. But awareness changes everything. When you know the risks, you protect yourself. You keep self-care what it was always meant to be, a source of healing, not harm. And that brings us to the next most empowering step, learning how to do this safely and joyfully after 60. Because once you avoid the mistakes, the path opens to comfort, confidence, and vitality that can truly transform your daily life. Stay with me, because what I'll share next is practical, clear, and something you can start tonight. When women finally whisper to me, "But how do I do this the right way?" I always feel relieved, because asking that question means you're ready, not just for pleasure, but for healing. After 60, your body deserves a gentler, more intentional approach. What worked at 30 may no longer serve you now. But with a few simple adjustments, self-care can become one of the most powerful tools for your health and confidence. Step 1. Prepare with comfort. Set aside time and space where you feel safe. This isn't about rushing or squeezing something in between chores. Dim the lights, silence your phone, take a deep breath. Tell yourself, "This is for me." That small shift in mindset sets the tone. Step 2. Always use lubrication. After menopause, natural moisture decreases. Without support, friction can cause tiny tears. Lubrication is not a sign of weakness, it's a sign of respect for your body. Choose a high-quality water-based or silicone-based product made for intimacy. Avoid perfumed lotions or oils from the bathroom shelf. Think of lube as nourishment, not an accessory. I remember Susan, 69, who told me she always skipped lubrication because she thought it was cheating. She endured years of discomfort. Once she began using it, her words were, "It feels like my body finally said thank you." Step 3. Take your time with arousal. One of the most common mistakes is rushing. Your body after 60 needs more time for blood flow to build, for tissues to warm, for muscles to relax. Begin with gentle, slow touches. Explore areas beyond the clitoris, your inner thighs, labia, and even the curve of your belly. Think of it as awakening circulation, not racing toward a finish line. Step 4. Explore with curiosity. Your body has changed, but that doesn't mean it's finished. Sometimes sensation shifts. What once worked may feel different now. That's not loss, it's evolution. Be curious, not judgmental. Ask what feels good today. You may discover new areas of sensitivity you never noticed before. Step 5. Breathe. Deep breathing signals your nervous system to relax, allowing more blood flow and more pleasure. Try inhaling for 4 counts, exhaling for 6, and imagine your pelvic floor softening downward with each breath. This not only enhances sensation, but also strengthens bladder control and reduces leaks over time. Step 6. Close with tenderness. When you're finished, resist the urge to scrub or rush away. Rinse gently with lukewarm water if needed. Pat dry softly with a clean towel. Avoid harsh soaps or fragranced wipes, they disrupt your natural balance. I'll never forget Linda, 72, who confessed she always jumped straight into a hot shower with strong soap because she felt dirty. She didn't realize that habit was causing the very irritation she feared. When she switched to gentle aftercare, her discomfort faded within weeks. Step 7. Rest. This may be the most important part. Give yourself 5 to 10 quiet minutes afterward. Lie back, breathe, allow your body to absorb the hormonal release. That's when oxytocin calms your stress, dopamine lifts your mood, and your immune system quietly strengthens. Skipping this rest robs you of half the benefits. Elaine, 74, once told me she felt lazy lying down after self-care. But when she allowed herself the gift of rest, she said, "For the first time in years, I woke up the next morning feeling lighter instead of drained." The bigger truth is this safe, joyful self-care after 60 is not about indulgence. It is about medicine. It restores circulation, strengthens your pelvic floor, improves sleep, lifts your mood, and perhaps most importantly, reminds you that your body is still capable of joy. So ask yourself, are you treating your body with tenderness, or are you rushing through habits that no longer serve you? Tonight, you have the chance to choose differently. Up next, we'll go even deeper. Because beyond safety and technique lies something greater: empowerment. Self-care isn't only about your body. It's about reclaiming your confidence, your vitality, and your identity as a woman. Stay with me, because what I share in the final part may change the way you see yourself forever. At this stage of life, many women quietly wonder, are my best years behind me? Is intimacy something I should simply let go of? I want to tell you with all my heart that is not true. I have sat with women in their 60s, 70s, even 80s, who believed they were broken, only to discover their bodies were still capable of warmth, of joy, of deep satisfaction. The difference was not in their age, it was in the way they chose to treat themselves with patience, compassion, and the willingness to explore. Self-care after 60 is not a secret to be hidden, nor is it an indulgence you should feel guilty about. It is as essential as eating well, exercising, or taking your medications. Each time you honor your body in this way, you send yourself a powerful message: I matter. My body matters. My pleasure matters. I'll never forget Rosa, 75, who told me she felt invisible since her husband passed away. She whispered, "I thought that part of me had died." But when she gave herself permission to reconnect with her own touch, safely, gently, she rediscovered a spark she thought was gone forever. She said, "I walk differently now. I hold my head higher. I feel like myself again." That transformation wasn't from a prescription. It came from within her. This is the deeper truth. Reclaiming your body means reclaiming your life. When you choose tenderness instead of shame, patience instead of rushing, awareness instead of silence, you rediscover the woman who was always there. You are not less because of your age. You are more experienced, more powerful, more deserving of connection, joy, and peace. So let me leave you with this question. If your body is still capable of joy, why would you deny yourself the gift of experiencing it? The answer, my friend, is simple. You shouldn't. And starting tonight, I hope you never will again. If this conversation spoke to you, I ask you to take one small action right now. Tap the like button so more women over 60 will see this message. Subscribe and turn on the bell so you never miss another honest conversation about your health, your intimacy, and your confidence. And in the comments, tell me what part of today's message resonated with you most. Your story may be the exact encouragement another woman needs tonight. Share this video with a friend, a sister, or anyone you care about, because silence has held women back for too long. Together, we can break that silence and replace it with knowledge, compassion, and strength. And before we close, let me remind you, this video is for educational purposes only. It does not replace medical advice. Every woman's body is unique. If you are experiencing pain, significant changes, or have personal concerns, please consult with your healthcare provider. Your well-being deserves personalized care.